the National Aboriginal Community-Controlled Health Organisation Oka Day Conference, with the theme, Men's Health Our Way. Let's own it. The NACCHO conference was an important opportunity to exchange information, ideas and strategies on Aboriginal and Torres Strait Islander male health. Aboriginal TV Channel 4 presents highlights from the conference, held at the Hilton Hotel, Darwin.
One thing I've been really impressed with is such a knowledgeable group of men from all over the country who've come together, who work at the grassroots. So we're going to get those ideas, and this is much more than a talk fest. This is really about setting ourselves up for just getting better results, and that's what people deserve, is that we have strategies from every level of government that's going to work with community at the grassroots to get much better results, because what we're seeing at the moment is frankly not good enough.
The theme of this conference is Let's Own It, is something that we probably need to take away about sexual health, because there's quite a bit to be done. I really will just talk about STIs for the first minute. Why do we worry about them? So the bugs happen despite best intentions. Often these STIs don't have any symptoms or signs, and people don't really know they've got an STI. Same with HIV. And particularly our remote and regional communities, the more you go regionally or remote, the higher the burden of infection is in those communities. If you have unprotected sex in a remote area, you're more likely to get an STI, because the burden of infection in that community is so much higher than it is in the city. It's not because people who live in remote are having more sex or that they're having more sexual partners. We know that from some studies that we've done. But the big thing is that we've got this great big burden of infection in communities, but they shouldn't be there. You can get them fixed up pretty much within a week if you get tested. So we shouldn't have these great big rates of STIs in communities. We also worry because lots of shame and stigma around STIs. But the really big thing I'm worried about at the moment is that we've got this great big burden of infection of STIs and an increasing number of HIV diagnoses being notified in these communities. And so the link between STIs and HIV is quite strong. If you have one STI or two STIs and you sleep with someone who's got HIV, you've got a much higher chance of HIV being transmitted because of the other infections there in that community. Whether compared to somebody who doesn't have an STI and they sleep with someone, it's pretty hard to transmit HIV actually through sex, but if you have other STIs, it's fairly easy to transmit because of inflammation and shedding of cells in your genital area. So if the virus gets in that area where the cells have shedded, it can easily be transmitted. That's how it occurs. And they estimate between 2 and 5 times greater if you sleep with someone that's HIV positive and you've got other STIs. So there's been lots of talk about all the other issues that affect Aboriginal men today, but for young people in the age group 10 to 24, the leading two causes of conditions among people, Aboriginal and Torres Strait Islander people in Australia, are chlamydia and gonorrhea by a long mile. I want to kind of move to about us owning this, and so all the clinical guidelines recommend testing for 15 to 29-year-olds, a test for reinfection, and a full STI screen if you've been tested for chlamydia or gonorrhea in your health service. So some of this is the responsibility of health services, but some of this is ours. We need to own this, particularly if you're in this age group, or if you've got nephews or sons or family members in this age group. So just briefly, we've got a whole lot of work underway trying to get this message out to young people in communities. So we've got these websites, so if you're working with young people, make sure you get them onto these websites. There's lots of information there for clinicians on these websites, and basically this is my toolbox that we need to make sure that we've got all these things underway to make sure that we keep our communities free from STIs and bloodborne viruses.
Oh yeah, there's heaps of aspects, different stuff, they're talking about tobacco, cancers, family violence, the whole lot, and they're all intertwined, and if we can work with all of them and try and sort them out, well then that's good. But feedback from everyone is, and it shows that we all have the same problem, so it's just working together and trying to find common ground to sort them out.
For people who've had a lot of complex trauma, a lot of really threatening, frightening experiences in their life, all those memories are going to have danger, danger, threat in them. So when we have a new experience, we feel that we're going to be in danger and we're threatened, and that triggers the fight or flight response, even if they're not in any danger. And so that's why people who've had a lot of trauma in their lives come across as being aggressive and violent, and may not have the empathy as well. And then this also causes significant health problems in our lives. This is a brain, well, two brains of a 3-year-old, and one is a really healthy 3-year-old who's had a lot of nurture and a lot of love. This is the 3-year-old who's had neglect, extreme neglect, and you can really see the significant difference in the way this brain has developed.
Bruce Perry, who did that, he's a psychiatrist, and he's the one where we got that image of the brain from. He's done a lot of work in this area, and what he's found, and many leaders in this area are now really kind of championing this, is that many of those activities that support healthy brain development actually map really closely onto the traditional practices of Indigenous communities throughout the world. So song, dance, repetitive song, repetitive dance, repetitive stories, being really connected to our natural world and spending time in the natural world and feeling connected to the natural world, these are all things that really support the healthy development of little ones' brains. But what they've also found is that these activities actually support the healing of people at our age, as adults, as young people, that those same activities that support healthy development in little ones' brains and bodies also support the healing of people whose minds and bodies might be compromised because of their early childhood experiences. You know, we always say Western science is kind of catching up with the 65,000 years of best practice, and some of the practices that are now supported as the most effective practices to support healing from childhood trauma are pretty much the traditional practices that our communities have been practicing for thousands of years.
So, what is nicotine? I mean, I'm sure we all know what nicotine is and what its primary function is, but it is a chemical compound that is the addictive compound that is within a cigarette. Back in the 80s, tobacco companies did some testing on nicotine-free cigarettes, and what they found was that it was a complete dismal failure because it took out the one thing that keeps people smoking, which is nicotine. It's a tool that they use within the cigarette, and they enhance it because their goal is to hook people young and hook them for life. And that's a slogan that's come straight out of tobacco companies. And that's where it all happens, right in that, what they call the reward center of the brain, where there's a whole bunch of different receptors, and one very specific to nicotine. Your brain just explodes with neurotransmitters like dopamine, serotonin, endorphins, and a whole bunch of other stuff that essentially makes us feel good. But behind it all is the fact that these cigarettes, that nicotine, even though it's having a good effect in a way, it's giving people what they want, behind it all, it's got all of these chemicals, upwards of 7,000 chemicals that scientists believe are in cigarettes now. And over 60 to 70 of those chemicals are carcinogens, which means they lead to cancer. One of the biggest ones, obviously, lung cancer, which is one of the major killers for Aboriginal and Torres Strait Islander people. So the secret's out. Essentially, they're targeting the minority. They're targeting the disadvantaged, and they want people to get hooked as early as possible and stay hooked for life. And what we know is that 80% of teenage smokers that start before the age of 15 or 18, around that time, will stay smokers for the rest of their life and most likely die as a result of that smoking. But as far as tobacco goes, it's such a hard product, a drug to quit, compared to these others which have such damaging health effects, probably a lot sooner than tobacco, but what we know over time, tobacco is the biggest killer. So right now, smoking in Australia, what could be more alarming than a smoking rate of nearly 3 times that of our non-Indigenous counterparts? What this leads to is rates that are double or more in things like COPD, which is like emphysema, chronic bronchitis and those kind of things, asthma, lung cancer. So we know that there's a direct link from smoking at a rate like that and health effects at similar rates. So we can see that the leading causes of mortality for Aboriginal and Torres Strait Islander people, number 1, cardiovascular disease, number 2, cancer, both heavily influenced by smoking.
We will have a significant focus during this Oka Day conference on issues related to trauma, social and emotional well-being and suicide. These are not easy issues to talk about, but they are so important to men's health. Suicide continues to be a major and avoidable cause of death for Aboriginal men, and an issue we must talk about. Aboriginal and Torres Strait Islander men between the age of 25 and 29 have the highest suicide rates in the entire world, according to a study of Youth Health released last year.
The Australian Men's Health Forum, we are the peak body for male health in Australia, with a particular focus, like you guys, on the social issues that shape men's health and well-being. Some issues around male suicide generally. I think the key one there for me is we need to know that there are 8 suicides every single day, that 6 of them are men and 2 of them are women. That ratio is roughly repeated in the Indigenous community, but across the Indigenous community the rate is twice as high. One of the key things that really sticks out for me, the incredibly high rate amongst younger males in the Indigenous community, but also that it is the second leading killer. If you actually look at the situations that men are facing, and not just their mental health situation, so, you know, money problems, family problems, the research is showing up that, finding that the majority of male suicides are linked to situational distress, not to mental health disorders predominantly. Those mental health issues might be there in the background, but they're not the predominant factor that's putting the man on the path to suicide. Between 70 and 80% of male suicides are being found to be linked to situational distress. These were some of the factors that were identified in terms of what makes programs successful. A lot of the talks we've heard, and a lot of you guys here will be doing at least 1 or 2 of these things. These may not seem like suicide prevention activities, but they are, because what you're doing is preventing people going down the path to suicide. So, you know, doing cultural business, mentoring, men's groups, it's all suicide prevention. It's upstream suicide prevention, helping guys before they get to the point. And any community approach should be consulting with men's groups and men's services and saying, how can you help, what can you do, because you're the guys who are actually connected to the men and boys in your community.
So guys, there's an opportunity for us to own this, and there's an opportunity with butcher's papers on every table. We're looking at basically you guys coming together collective and looking at 3 to 4 points to look at good suicide prevention strategies. And this is something that we want to discuss as men together, but it's something that we're looking at as a national strategy that we're looking at from our Oka days.
I believe that as a trainer in the assist stuff, there should be more training for younger service providers in the community and all around Australia. Having experienced people up there to talk about their experiences, how they did it. I listened to this young fella here. The water, the ripples in the water. Wow, I identify with that. And many more. I don't knock the Indigenous or the Western ways on an intervention, because it's all about a holistic approach.
We think there needs to be more support for boys going through the journey to becoming men. We need that support because that's where there seems to be the gap. We thought what would work well is a two-way path as well between culture adapting to the changes of society as it is today. So that's not losing our culture, but enforcing it, adding another circle, using things like technology to teach our young ones who adapt to that technology today.
Third point was alternative justice. I can speak from personal experience. Myself and my colleague here from WIDAC, we work in Warlpiri communities, and we're privileged to have a Mount Theo outstation program where we take, it's like for lack of a better term, a cultural rehabilitation centre. So instead of going to juvie or jail or even voluntary before a court date, young people can go there and spend any time from a week to months. It's 160 k's away from Unimus, about 500 k's away from Alice Springs, and the more that we can have that, justice reinvestment programs, it's definitely preventing suicide. And we think it's a really important way forward.
Suicide Prevention Summit. Just to touch on it, a lot of the summits that we've had in the Kimberley, it's good to have summits, but you need actions to come out of there rather than a talk fest. Today, we'd like to see action come out of the men's Oka Day. Where are we going to go from here, there? And it's action and it's not talk.
Everywhere I go, I travel in communities right around the country, all right? Now, Aboriginal and Torres Strait Islander people, First Nation people of this land, have the highest suicide rates in some ages on the planet. On the planet. We're always looking for something, someone to help us, to fix us. I'll tell you where the answer is. Pre-1788, we didn't have suicide. Fast forward 230 years, we got the highest rates on the planet. Something's telling me to go back to living the way that we used to. Now, I'm not telling you to go out and live in the bush and chase your own feed. By all means, I'm a hunter and a gatherer, but I just do it at Coles. What I'm telling you is learn, listen to those values of them old people. The single biggest healer for me in my suicidal ideation, the voices that tell me to take my life every single day, the biggest healer, just like when we were kids, we always want our mother, is our culture. Our culture, our Mother Earth. Take your shoes off, put your feet in the ground, and you'll see the value in that. You know, you see the values that our old people used to live with. Things like love, respect, having humility, having care. It's not hard to live with these things. We're living in a society where we're all looking out for something bigger. We're all looking out that we want something. It's time to empower ourselves. It's time to stop looking to the outside and wanting the government to fix us. Somebody tagged Malcolm Turnbull, please. Because he's not going to help us. The government's not going to help us. Our self-appointed leaders aren't going to help us. The people who are on the ground, hearing the cries, the people who are on the ground, wiping away the tears, you're going to help us. You're going to help us save us. Because that's who we can count on. We can only count on us. The sooner we realise that we are a powerful people and we can empower each other to a better tomorrow, the sooner we'll start to heal. Go back to your community, show love, respect, humility and care for everyone, especially our females. We come from the mother, we come from Mother Earth. We all have mothers, we all have daughters, we all have sisters. Let's respect everyone, let's love everyone, let's care for everyone, and let's be humble about it. From my Wiradjuri people, Yindi Maragiri Duman Gangalandi Bu, Gagangalandi Bu. I love and respect you all. Thank you very much.
The National Aboriginal Community Controlled Health Organisation, working towards a healthy future for Aboriginal and Torres Strait Island people.